Hello, ladies and gentlemen. This is Daniel Montano. We're here to start the Zhittya Parkinson's disease research study, 6-month patient follow-up report. First of all, I'd like to thank you all for being here. We have several thousand people that have registered for this presentation, and I hope that you'll find it enlightening and beneficial. First of all, I'd like to make a quick introduction to Zhittya because we have a lot of people that have never participated with us before. Zhittya's management for the last 20 years has expended over $150 million advancing this molecule to heal the human body. We have done US FDA cleared clinical trials for the heart. Dr. Jacobs will show you a clip of that where we have grown blood vessels in the heart to treat heart disease. We have done phase 2 diabetic foot ulcer healing. So we have other indications that we have advanced, but this one is about Parkinson's disease, and we'll be talking about that. So we've advanced the medicine into the brain. Primarily focused right now is Parkinson's disease. What I'm going to do is Dr. Jacobs and Victoria Montano are going to give you the patient data. One of the things I want to make a comment, by the way, is that please keep this in mind. The presentation you're going to see is a summary of data. The videos are small snippets of the data. There are 10 hours of patient videos. None of you are prepared to sit for 10 hours and watch all these. So for the sake of a presentation, we have trimmed it and added to it. We've tried to be fair and keep it balanced. We are not trying to make an argument. We are going to show you the good, the bad, the ugly. But once again, we're not going to show you blood test results. We're not going to show you this and that, because there was no medical or no adverse events. Nothing happened other than people changed after they took the medicine. So I want to make that clear. This is for those of you that think this is going to be a peer review, you're going to be surprised it's not. So what I'm going to do now is introduce Dr. Jack Jacobs. Dr. Jacobs has been my partner for over 20 years. He is, beyond a question, one of the nicest people I'll ever meet and one of the smartest people you'll ever meet. Jack's been working on this molecule for eternity. So, Dr. Jacobs, would you please give your presentation?
Thank you, Dan, for that nice introduction. As over half of you viewers have not tuned in before, and it's the first time you're hearing this story, I'd like to take a few minutes to go over what our drug does, FGF1, fibroblast growth factor 1, how it works in our bodies, and then go on and talk about the results we're getting in our clinical trials, our medical research studies with Parkinson's disease patients. FGF1, this is our drug, stimulates a process known as angiogenesis. Angio is blood vessels, genesis is new. FGF1 is probably the most potent stimulator in our bodies, producing new blood vessels. We use this process all the time. This young boy who scraped his elbow is going to use FGF1 to heal that scrape on his elbow. Let's take a closer look at this. So in this diagram, that dotted circle is the wounded area on that boy's arm. And if you look underneath that dotted area, say this is the scab forming on his arm, we see all these brand new blood vessels, which have been formed, stimulated by FGF1. And what those new blood vessels are going to do is to bring in nutrients, oxygen, and remove waste products from that wounded area. And they're going to heal skin as an organ, produce not only new blood vessels, new nerves, sweat glands, whatever is needed to form skin as an organ. So let's talk a little bit about our protein drug. This is a polypeptide, natural product. As a graduate student, I actually worked on this at Washington University in St. Louis, purifying it from CalBrain. We're not using CalBrain FGF1 in our clinical trials and our medical research studies. We make it in a FDA inspected facility as shown here. And in the middle there, you see what's known as a bacterial fermenter. We can grow up unlimited quantities of bacteria which are producing the human FGF1. We then purify it. So we end up with very potent, pure, and sterile FGF1, which is used in our clinical studies. The first clinical trial that I actually supervised wasn't in Parkinson's disease. We looked at this FGF1, its ability to grow new blood vessels in no option heart patients, they're called. These are patients that have no options. They can't have a bypass surgery done. They can't have stents put into their clogged coronary arteries. really our FGF1 is their only hope. So we had 6 clinical trial sites in the United States. This was an FDA authorized study. And let me just show you a film clip. ABC Nightly News went to one of our sites at the University of Cincinnati and interviewed cardiologist there, Dr. Lynn Wagner, and some of the patients. Okay, so rather than me show you graphs and charts, let's look at the ABC News clip. You'll see the FGF1 being pulled up into a syringe and being injected directly into the heart of a patient.
But since receiving an experimental treatment for his blocked arteries, his pain is gone.
I really feel great.
Duke was one of the first heart patients in the country to be treated with a protein actually capable of growing brand new arteries. The genetically engineered protein is injected directly into the heart. Within days, a network of new vessels begins to grow around the blockage, increasing the blood supply. Dr. Lynn Wagner showed us the changes in one patient's heart.
We see a small, narrow main artery and not very many secondary and tertiary arteries. This is after the treatment. What we're now seeing is new blood vessels growing here off the end of this artery.
And the patients themselves?
Symptomatically, they're improved within a couple of weeks of the treatment.
Just ask Constance Donnelly.
Oh, I feel wonderful. I've never felt so good in the last 5 years.
But doctors already see potential in other cases where the blood supply needs a boost, such as strokes and diabetes.
So that woman we see there, Constance Donnelly, that was her heart we saw. That was an angiogram of her heart where the new blood vessels had grown. She actually came into this clinic, this trial as a cardiac cripple. She was in a wheelchair. There you see her 12 weeks later, up and about. We're going to continue these heart studies. We're very excited about continuing them, and we have applications into 3 separate countries to begin work in 2023. Let's move now on to Parkinson's disease. This is a prevalent neurological disease. Worldwide, it's estimated 30 million individuals suffer from Parkinson's disease. This is statistics from the World Health Organization. In the United States, it's known that over 1 million patients suffer from Parkinson's disease. Now, most of you know this, but Parkinson's disease results from the lack of dopamine production in the brain. So we have dopamine-producing neurons in the brain that become affected by Parkinson's disease. In a healthy individual up top there, you can see a normal neuron releasing normal amounts of dopamine and activating receptors which lead to normal movement. In Parkinson's disease-affected neurons, and we and others believe this is due to a lack of blood flow to nourish these neurons, less dopamine released, movement disorders result, including tremors, slow movement, and rigidity. So I mentioned that we and others feel that Parkinson's disease is initiated by a lack of blood flow in that area of the brains that house the dopamine neurons. So let's look at some evidence that supports that. You can look in real time at regional blood flow with functional MRIs as an imaging technology. And so this is not our work, but work done by academic centers have shown a dramatic decrease in regional blood flow in patients with Parkinson's. So this graph here in blue, that's a healthy 21-year-old, and that's looking at the area in his brain that contains the dopamine neurons. In green, we know as we age, we have less blood perfusion. But look at Parkinson's disease there in orange. Over 50% reduction in blood flow in that area of the brain which houses the dopamine neurons. So we believe neurons are getting choked off from their blood supply. This leads to them becoming dysfunctional. This leads to the movement disorders seen in Parkinson's disease. Now, the same technology can also be looked at in other areas of the brain. This is a same type of scan in a woman who has dementia. Her whole brain should be blue colored, which is normal blood perfusion. But you can see here patches of yellow, less perfusion, and red is severely reduced blood perfusion. These are lining up in areas that we know are responsible for memory, emotion, cognitive, executive functioning, and cognition. So we believe if we gave this patient FGF1, not only could we hopefully restore dopamine neuron function, but also heal these areas in our cortex that are involved in cognitive function. Okay, this cute guy is actually the gold standard animal model for Parkinson's disease. This primate, it's a primate model. He can be given Parkinson's disease by injecting a neurotoxin into his brain, which selectively destroys dopamine neurons. And the monkeys come down with all the classical motor symptoms of Parkinson's. They develop tremors, they have gait disturbances. This FGF1 was looked at in this monkey model of Parkinson's disease with very positive effects. So let me just go through this graph with you. MPTP, that is the neurotoxin I talked about. That's injected at the very beginning of the experiment into the brains of the animals. Two groups of animals, one in blue, one in red, both get the neurotoxin. And we're looking at motor scores. So 4 on this graph is normal motor function. 1 is highly abnormal motor function. You can see out there at 9 months in that graph, both groups of monkeys are exhibiting the classical motor deficits seen in Parkinson's. One group at month 10 gets FGF1 infusion. Second group of animals gets placebo, or basically sugar water. And you can see as we march along, month 10th, 11th, 12th, and onward, the blue group, the FGF1 treated monkeys, start to regain back motor skill function, where the placebo-treated groups continue to decline. And at month 17, the FGF1 treated monkeys are almost back to normal, where the placebo-treated animals still have grossly abnormal motor skills. Now we can look in the brains of both groups of animals and say, are we affecting production of dopamine neurons? And indeed we are. This slide, so dopamine neurons stain brown in this experiment. So you can see below the FGF1 treated animals, brown area, that's newly regenerated dopamine neurons, where we don't see that in the placebo-treated animals above. So we believe this regeneration of dopamine neurons attacking the root cause of Parkinson's disease in these animals is restoring movement. Now, one other condition these monkeys and also humans develop with Parkinson's disease is the accumulation of toxic proteins in their brains. This is similar to Alzheimer's, the beta amyloid plaque. In the middle panel there, that's a brain slice from a Parkinson's disease monkey. You can see that accumulated alpha-synuclein plaque there. That's toxic. That's toxic to the dopamine neurons. So basically a double whammy here. Less blood flow, hurting these dopamine neurons, and this toxic tangle of protein is also hurting these neurons. But you can see on the right-hand panel, when we treat with FGF1, we're eliminating a large majority of that toxic protein, we believe being swept away by increased blood perfusion. Not quite back to normal, which is that sham panel on the left, but much better than the middle panel. So in this monkey model of Parkinson's disease, we showed 3 things that are very important. We improved motor skill function, we generated new dopamine neurons, and we got rid of this toxic accumulation of protein. So this signaled to us this is ready for the clinic, ready to go into humans. All these studies with monkeys, and I didn't show you the rat studies, were done by infusing the FGF1 into the animals by intravenous infusion. We've been very lucky to find that actually you can get FGF1 into the brain, into the brains of Parkinson's disease patients by squirting it up the nose. So using a nasal inhaler, FGF1 travels through what scientists believe is through the olfactory nerve, shown in yellow here, and the trigeminal nerve. We actually showed, and I'll show you on the next slide, that you can get twice the amount of FGF1 into the brain by squirting it up the nose versus sticking it, infusing it intravenously in someone's arm. So we collaborated with scientists in Minnesota. These are animal studies. They made FGF1 radioactive, squirted it up the animal's nose, and then said, where does it go in the brain? And this is a bit of a complicated slide, but let me just walk you through it. It shows that in these animal studies that after intranasal administration, FGF1 is widely distributed in the animal's brain. Down below there, you can see different areas of the brain and the amount of FGF1 which is found there. So for example, the very left side of that graph represents FGF1 getting into the substantia nigra. That's where the dopamine neurons are. You can see in gray there, that's the amount that gets in via intranasal delivery versus the darker bar is intravenous. So we're getting twice the amount of FGF1 into the substantia nigra region of the brain by squirting it up the nose versus intravenous administration. And basically, this graph is very good news, we believe, for patients with other neurodegenerative disorders. For example, Alzheimer's mainly affects the hippocampus. We can see here plenty of FGF1 gets into the brain. And one point I forgot to make is that red line there on the bottom that says FGF receptor activation. That's the amount of FGF1 you have to get into the brain to have a biological response, to grow blood vessels, to have new nerves form. And you can see throughout the brain, we're well above that. Lou Gehrig's disease, that affects the rostral cortex area of the brain. That's right in the middle there. We're getting much, much higher amounts into that area of the brain intranasally. So we are looking forward to trying this therapy in people with ALS as well. Let's look at Parkinson's disease a bit closer. This shows the normal course of Parkinson's disease, and the bottom line is regardless of current pharmacology treatments, the progression of Parkinson's disease continues. And you can see that in that graph on the right. We're looking at motor skill scores on the left there. Same testing we do with our patients in the British Virgin Islands. So the higher the score, the greater the disability. 0 is perfectly normal. 5 is highly abnormal. And you can see both in medicated patients, that's the red line, and in unmedicated patients, that's the blue line, there's a relentless, inexorable increase in symptoms. That is, the symptoms are getting worse over time. This plots progression over 5 years. You can see 3 years there at 36 months, the medicated people join up with the unmedicated. And again, in both groups, the symptoms continue to get worse. So in our treatment, we would be looking for a slowing down of this progression, a leveling off, and hopefully even an improvement in people's motor skills. And that's what we're finding. So far in the British Virgin Islands, we've treated 7 cohorts of patients. To date, we've treated 28 patients. Importantly, drug is safe and well tolerated, given intranasally to all the patients. We've seen no adverse events, which we follow closely in any of the patients. And importantly, very importantly, we see motor improvements. None of the patients have declined over the period of time we've looked at, and that's between 1 and 6 months. So we're still early on. We're going to be following these patients, but so far these results look very promising. Patients have improved from 18 to 82% on that motor score testing. So that's actually, if you remember those lines I just showed you going up, these people's lines would be going down. So I'd like to show you some results, some video results of our patients. We filmed their progress in the British Virgin Islands. This shows lab rat number 2, Becky, before there's tremor in her hands on the left. And on the right, you can see after 30 days of treatment. I think you'll agree that her tremor has improved. This is another test video. It's called finger tapping. On the left, it's before FGF1 treatment, and on the right, after 30 days of treatment. I think it's really obvious here. Look at her right hand, very affected there before treatment. And then on the right, this is her left hand, and then we'll see her right hand shortly. There we go. We really think that's an improvement in that finger tapping test. Again, standing up from chair is another test in the Parkinson's questionnaire. You can see she's having a lot of trouble on the left there before treatment. 30 days after treatment. On the right, she's popping up like a jack in the box. She was a good patient. This shows walking test on the left before treatment, on the right after treatment. Still, she has a little shake in her right hand, but she's moving quicker after treatment. And also on the left before treatment, again, she's slower turning around, kind of grabbing onto the chair. On the right there, she finishes up happy. You can see she's kind of drifting here with her gait. Again, she wasn't doing that after her treatment. This is our anesthesiologist, lab rat number 1, doing this standing up from chair. On the left before treatment, on the right after treatment. Again, you can see on the left there, he's having some difficulties. Again, he was treated for 30 days daily with intranasal FGF1. This is the finger tapping exercise before treatment on the left, after treatment on the right. And I think you can see a real improvement in his right hand there after treatment, after 30 days of treatment.
Hi, I'm Daniel Clark. I'm an anesthesiologist, and I'm also lab rat number 1. And I even have the t-shirt to prove that. Becky Parker and I were at ground zero for the testing of FGF1. We were the first humans to trial intranasally and test it for safety.
Yeah, you were talking about kind of some cognitive issues, trouble focusing. I remember when you got home, you said you were able to read a book at night for the first time. Where would you say that is, compared to
I would say that my focus is better. I can multitask a little bit better. Obviously, my appearance has improved. I'm more spontaneous emotionally. So cognitively, I'm improved. Like I mentioned, memory, multitasking, focus, emotion. I'm thinking it took years to get to this point. So it's probably going to take a while to reverse it. I'm hopeful because of the improvement cognitively and also the improvement with fine motor control that we showed on the right thumb index. And that was evident after just 3 weeks, I think, in the BVI.
All right. Any eating issues? Cutting your food with your silverware?
No. My wife seems to think that I used to have a fine tremor when I brought the spoon close to my mouth, and that seems to have improved.
Okay. How's your handwriting?
It seems slightly improved, doesn't seem as small.
Now tell me your medications and how many times a day do you take those?
I was doing a TID, and I don't know when I decreased it, but I decreased it to BID. I'm doing a BID, and I'm doing a 1.5 of the levocarbidopa.
Okay, what do you mean by 1.5?
It's 1.5 tabs.
Okay, and that's twice a day, you say?
Correct.
And you don't know when you switch that over, because that's basically you decreased your dose, right?
Yes, because I really hate taking that shit.
Okay.
By side?
Yeah. Try it. Yes. Yeah, it still looks like your left is a little bit better than your right. Would you agree?
Maybe slightly, but I
Yeah.
can move the right just as I couldn't do that before.
Okay. Yeah, I can see that. Okay. All right.
Okay.
Yeah, I can see that. Okay. Yeah, that's good.
Cucumber. I had my neurology visit and I mentioned to him that I had taken the experimental drug, and he seemed slightly interested, but not really.
Slightly. That's an improvement over most neurologists too.
He was like, "Oh, really? Okay, now let's get back to your regular meds."
Yeah.
Because he said, and I read his notes because I can get into my chart, and he wrote, patient seems slightly improved, which he attributes to the experimental med.
But you're right. You're his patient, and he sees improvement. So he's got to. He can't.
He's got to attribute it to because I haven't changed my medication. I've actually decreased the medication.
You seem to be decreasing your meds. Your neurologist said that you seem better. So.
Well, I told him my cognition was improved.
I am the husband of Becky Parker, who participated in the BVI. My name is Chris Parker, and I have been pretty much her caregiver.
She's had Parkinson's for how long?
Since 2012.
Okay. I mean, your role started in 2012 and is just getting bigger, right? Would you say, or not?
When we got the opportunity to visit the BVI in May, when we were done with the treatment that was administered to her, she was feeling a lot better. It was just simply amazing. And then you gave her profile then afterwards. And according to the profile, she was pretty outstanding, or a lot of improvements. I think it was close to 50%.
That's correct. On her motor skill examination, doing her fingers and her tremor. Yeah, she was 53% improvement over pre-dosing. So in 1 month, she had improved 53%.
So when we returned back from the BVI, she ended up getting COVID, and she got pretty sick with that COVID. So after recovering from COVID, she developed this real severe sharp pain in her belly. And according to the doctors, it was in her GI tract. The pain was so unbearable. So we went to the ER and they admitted her immediately. The doctor came over and they ran some tests on her. She's developed kidney problem, which was a complete shock to us. We didn't even know that was happening. And for about 8 days, they treated her for kidney and actually put her on dialysis. So the next day, results came back after they took some more blood and found an improvement. So then they decided to remove the catheter and didn't have her on dialysis after that. And he continued to monitor her, and she was getting better. He figures, well, the kidneys are doing better. And he said, according to me, there are no kidney problems. She's improved a lot in her kidneys functions, because she was at 10% kidneys when they tested her.
Wow, that's pretty severe, 10%.
A GI doctor was up there. And the first thing he says, okay, I'm going to do a colonoscopy endoscopy tomorrow. Saturday morning, they took her in and they did an endoscopy on her and a colonoscopy. It was amazing. When they pulled this colonoscopy out, it was 3 to 4 centimeters big.
So that was like a growth? They removed a growth?
It was a polyp.
A polyp, okay.
And along with that, they also found that there was an ulcer in her stomach. She was going through a lot of medical issues, after BVI. So once the polyp was removed, they had given her some meds for that, which seemed to help her. Over a 6-week period, she had lost a total of 17 pounds, and she was pretty thin to start with. And her appetite was not there. So that was probably part of the reason also. After she got released, I would say as a caregiver, other than her walking, her balance is still a little bit off, and her shaking was getting worse a little bit, just a little bit worse. But like I said, there is an advantage to being a caregiver because you start noticing small, little, minute improvements going on. I've seen small improvements. Did she recover back to where she was at BVI? No, not right now. But did she have some improvements? Yes. So she still has improvements. So whatever happened at BVI with the administration of the FGF1 factor, it still worked, even with all the issues and problems that her body was going through during that time.
That's quite a saga, and I'm glad Becky's on the mend, and we'll be in touch for a while here.
Just want to let you know, we're thankful and grateful for Zhittya, for you and Dan, and continuing the hope that we both have with this program and how it's working. Because I really, truly believe in my heart that if she hadn't had those treatments in BVI, things could have probably taken a different turn.
We appreciate her bravery as being a warrior and volunteering for experimental treatment, and so we thank her as well. How's your sleeping now?
It got really good after I got back from the BVI. I was sleeping like almost all night, only waking up once.
Okay.
That was like really rare. But after the episodes, it went back to being waking up more during the night again.
Okay.
But with the UTI, that would keep me up too. I had to run to go to the little girl's room.
What about in general, fatigue levels?
Battling fatigue right now, but I think it's also still I've lost 15 pounds from the hospital, from COVID till now, and I haven't been able to put it back on but a little bit. So I can chew fine, I swallow fine.
So walking and balance, do you have problems when you're walking with your balance or walking in a straight line or?
Compared to the BVI, it's getting closer to back to where it was like in the BVI. My walking's getting better. Okay. The physical therapy they had me doing after the hospital stay, they're coming into the house and they really worked on my balance and it drastically improved.
Just an added to that, Jack, is that here in the house, because we had some in-home therapy going on, when she sit on the love seat, the PT would time her time she got up, walked over to the fireplace and back. So her initial one was 33 seconds, and it's maybe, close to, 8-10 yards. Or feet, I'm sorry. Epic. Towards the end of her therapy, she went from 33 seconds to 13 seconds. So that was an improvement.
That was, and when was that, recently?
Yes.
A couple weeks ago.
Couple weeks ago.
That's why I said I'm gaining my strength back again that I had lost from being so sick.
All right, so we're going to do a little bit of the motor. Yeah, when you first did that test in the BVI before any treatment,
I was a little slower.
Yeah.
I haven't lost everything, but.
Okay, so the next test.
You said to turn it over, right? 5, 6, 7, 8, 9, 10. 1, 2, 4, 5, 6, 7, 8, 9, 10. Okay.
You did that well. Good. You can still do that.
I can. The hand's gotten a lot worse. Okay. I'm right on each hand. I'm starting this morning. Thank you.
Yeah, it's taking back.
Good. Good. You did that well. I remember some of the videos of the BVI where you're putting the yellow device up your nose. Remember you had some real trouble getting that?
Yeah. Well, I can tell as time goes on, when I'm relaxed, if I'm not having the pain in the stomach, everything else is a little bit better. So pain intensifies the tremor.
Hello, I'm back, and I want to talk a little bit about how Dr. Daniel Clark, he was lab rat number 1 you saw there, has really helped us as a physician in intranasal delivery of our FGF1. So I just want to talk a little bit about how he's helped us.
If you're recommending to another patient, the best thing to do after the dosing, what would you recommend?
I mean, the position?
Yeah, the position.
Well, you have to put your head down. And so I get on my knees and I try to put my head as vertically as possible because the olfactory is sitting in the superior aspect of the sinus. Here, I can show you my teaching aid. So this is a sagittal cut with the septum folded up like a clam. And you can see the tendrils of the olfactory right here. And then you have the area highlighted in yellow, which is the potential space to get past the turbinates. So if you turn this upside down, you can see that the tendrils of the olfactory are sitting pretty much on the bottom of the
Okay.
positioning. So if you're like this, it's going to be sitting in the front of the sinus. If you lay on your back, tip your head back, it's going on the back of your throat.
And so you do this, you're on your knees with your head on a pillow on the floor?
What I do
Put your kind of head on your fist. Okay.
and on a pillow, you can't really get it far enough, it seems. Although maybe you can.
Okay, people often ask us what the difference is between a medical research study and a clinical trial. I've done both, so let me tell you my view. Clinical trial on the left, that heart study was a clinical trial negotiated with the US FDA. So we had a protocol. We would go back and forth with the FDA. But once we both agreed, or more likely that they agreed on the protocol, it was set in stone. No changes could be made. All patients throughout the whole trial had to be treated exactly the same. Another important point is in clinical trials is that 50% of the patients get a placebo dose. They don't actually get the drug. And nobody knows that. No one knows. The patients don't know. We don't know. The physicians don't know. But that's, in my mind, a drawback. The objective of clinical trials, which sponsors always pay 100% of the costs, such as Zhittya, the objective is to obtain US FDA approval. So it's not really, in my mind, aimed at the patients, it's the company's financial objective to get an FDA-approved drug. Let's contrast that with a medical research study, which we're doing in the Caribbean. We get ethics committee approval to do these trials, so we submit our clinical protocol to a group of physicians. They review it, they approve it, and they look at it to make sure there's no potential harm to the patients. Unlike a clinical trial, we can change the dosage. We can change the duration of treatment. And we've done this in the British Virgin Islands. So we've done a month's worth of treatment. We've done 2 weeks worth of treatment. We've done a week of treatment. And every single person who we treat gets the FGF1. There's no placebo given. And our company's objective, is to find the best treatment for patients with Parkinson's disease. Now, as I mentioned, since the FGF1, when intranasally administered, gets into many different areas of the brain, we really feel strongly that we should have the responsibility to initiate other medical research studies in different nervous system diseases. So this is our plan: clinical studies, medical research studies in 2023 for this coming year. We'll continue Parkinson's disease, obviously, and we'll treat different types of Parkinson's disease, patients with deep brain stimulators, DBS, patients who've had a DBS removed. We're going to move on also and test patients with multiple systems atrophy. In fact, in December of 2022, we treated a patient, our first patient with MSA, and also our first patient with progressive supranuclear palsy, PSP. As I mentioned earlier, lots of FGF1 gets into areas of the brain that are affected in motor neuron disease, ALS or Lou Gehrig's disease. Hope to start a study in 2023 in that disease as well. Also stroke disability, MS, Alzheimer's, vascular dementia, and post-traumatic stress disorder, PTSD, which very of high interest to the military. Okay, so that wraps it up for me. I'd like to now introduce to you Vice President of Zhittya Genesis Medicine, Vika Montano. She's, in my mind, a gifted biologist. Actually, she trained as an architect and is now really helping us out quite a bit in our medical studies in the Caribbean. So I'll turn it over to Vika at this point.
Thank you, Jack. My name is Victoria Montano, and I'm Vice President of Zhittya. Like many members of our team, I go to the medical research study places to meet the patients, to see how study going on, and just supervise the process. I'm going to show you 3 videos, 2 from the cohort number 1, 2 patients are from cohort number 1, and 1 patient from the very recent cohort number 7. At our studies, we filmed our patients to measure their scores on physical performance. So you will see the videos before, during our test, before the treatment, and the other videos are provided by our patients after the treatment. Each patient participating in the study signed release that they know this video will be used for educational purposes. Let's take a look at our first star, is Bobby Hill. We can see on the left side is the video before the treatment. He has a quite pronounced tremor on his right hand. On the right side, we can see video 2 weeks later. He filmed himself at the airport, and we can see the tremor is gone. We visit this patient about 2 months later after that in Midland, Texas, and he still maintained his achievement, which is pretty good. Next star is Lisa. So you can see Lisa walking. You can see she is heavily leaning on the right and dragging her right leg. Aside that, we can see that she is not happy. The next video she provided, it's about 2.5 months later, on the wedding of her daughter. We can see she's dancing here. There is no cane anymore. She is not leaning anywhere. She's wearing high heels. They're not huge, but the high heels about 1 or 2 inches high. And she's happy. Oh, no, guys, this video is long, but I enjoy watching her dancing. You can see how both of them enjoying it, the husband and Lisa. It's beautiful to see. So we can see it again side by side. Lisa before the treatment and after, for those who could not catch the difference. I think it's pretty awesome.
Unfortunately, not every patient recovers so quickly and so awesomely like previous two. So for everybody, it's different. Somebody improve in drooling or tremors, somebody improve in walking and balance. So it's not predictable. Every patient is different. Every disease patients have varies. So recovery is going on different. Next patient is from cohort number 7 from 2 weeks ago. So you're gonna see his video before the treatment, and then 5 days later his wife filmed him in hotel room and she's narrating the video. We're gonna listen to her. Of course, improvements in 5 days are not great, but they're about 5-10%, and you can tell by the voice of his wife she's excited about it. Let's listen to Gifford and Gifford's wife.
Fingers touch your nose to the side. Okay, Gifford, take your other hand, do the same thing. Okay, now I want you to take your hands like we did in the first video and open them up wide and then clench. Do we all remember the last video when he couldn't do that at all, barely? Now hold your hands out straight. Try to flip them as much as you can. Okay, we have a little bit better there. All the way, best as you can. Now remember, we had trouble even doing this sitting in a chair. Okay, now stand up. Oh my God, oh my God. Stand up again. Jesus God, thank you. Unassisted from outside on his own. Unassisted.
As we all know, some Parkinson's patients, they lose their sense of smell and taste. And we have some patients who reported that their sense of smell and taste came back, and Gifford was one of them. Actually, there were 2 patients whose smell and taste returned, but Gifford was the most loud about it. Let's listen to Gifford.
2 days ago, I couldn't taste this. Now I can.
The next one will come up after me, Sam Cross, the president of the Cross Border Medical. He helps us with the patients for clinical trials and medical research studies. Sam Cross, please.
Thank you, Vika. I'm Sam Cross with Cross Border Medical. We have an agreement with Zhittya to handle everyone that is interested in both the US FDA clinical trials and the medical research program. The clinical trials are scheduled to begin in approximately 2 to 4 years, and they will be 100% funded by Zhittya. When Zhittya receives clearance to begin the clinical trials, we will begin the process of contacting everyone that's already on our waiting list and the future people who sign up. From there, we will begin phase 1 clinical trials, which is anticipated to consist of about 15 to 20 people. If all goes well, in approximately 2 to 3 years, we'll begin phase 2, which will incorporate another 120 people. From there, we'll move into phase 3, which will begin in another 2 to 3 years and should incorporate about 500 additional people. There will be a placebo group in both phase 2 and phase 3 where patients will not receive the medicine. Medical research studies, these are designed to discover what works best, the proper dosage, the proper length, the proper device, and the proper formulations for the clinical trials that will be held in the future, not for gaining government approvals and clearances. These studies are very small groups, which we call cohorts, which consist of 4 to 10 people. We're currently cleared in the British Virgin Islands, Panama, the Bahamas, and Mexico. Currently, the only site that is fully functional is the British Virgin Islands, as the other locations are pending governmental permissions that we believe should fall into place in the first quarter of 2023. Currently, we are enrolling candidates for Parkinson's disease, multiple system atrophy, and PSP. However, in 2023, we are looking to add several other medical indications, which will include multiple sclerosis, stroke, Alzheimer's, ALS, PTSD, and CTE. The next cohorts scheduled currently are cohort 8, which is January 18th through 24th. Cohort 9, scheduled for February 16th through 22nd. Cohort 10, which is for March 18th through 24th. If you're interested in finding out any more information about these cohorts, please feel free to email me directly at sam.crossbordermedical@gmail.com, or please use the Zhittya website or the Cross Border Medical website, and we'll be happy to answer any questions you have or get you enrolled, as there's only a few spots left. Thank you very much and have a great day.
Hello, ladies and gentlemen. I'm Dan Montano. I'm going to be giving the closing remarks, the conclusion. First, I'd like to thank Sam Cross for his introduction there. Let me make a comment. Everybody keeps asking, what's the difference between clinical trials and medical research studies? And let me take a moment, since I'm the chief executive officer. And as I said before, Jack and I have expended $150 million getting to this point. The Parkinson's phase 1 trial in the United States, the clinical trial that the FDA will give us clearance on, will probably cost us between $3 and $5 million. The phase 2 trial will probably cost us between 10 and 15 million. And the phase 3 will probably cost us 15 to 30 million. To get a drug approved in the United States, according to Tufts University, takes around 18 years and costs about $800 million. Therefore, you don't want to start that process until you have the right answers. How much do you dose? How long do you dose? What is the best benefit? At what point do you have issues? And everybody seems to think that you know that before you do the discovery work on humans. Now, you can do work on animals, but you cannot learn much. The medical research studies that we're doing have been tremendously beneficial to us, and I believe to everybody with Parkinson's disease. They've been great because we've learned so much in 6 months. We are now dosing at twice the level we started because we know it's safe at twice the level. We are now seeing more improvement by the head position you saw with Dr. Clark, that it seems more molecule is being absorbed. We have enhanced the device, and we've learned things from humans that we can't learn from monkeys. Sleeping better, walking better, talking better, better balance, return of memory, return of taste, clearing up brain fog, improving memory, improving speech. These are things that we learn from these people in just a few short months that we've been doing this. We've learned how to do things. Now, you saw that Daniel Clark and Becky are very proud of being called Lab Rat 1. That was their title they came up with, and Becky's Lab Rat 2. Well, I'm Lab Rat 3. I also took the medicine because as the chief executive officer, I am responsible. And if I'm going to tell people it's safe, then I should have the courage of my own commitments. So I have taken the maximum dosage for 30 days, and I have no adverse event that I'm aware of, although my wife still has a lot of problems with it, but that's been going on for 20 years. So what can I tell you? Now, the reason I want to talk about the medical research studies, because it's also good for the test subjects. The first all is the difference between a clinical trial and a medical research study is the medical research study. We're trying to find out what works for the patient. We're trying to find out how do we treat them better? How do we improve their condition? How do we find if there's a cure? And so we're out there not trying to impress a regulator that we achieve this. We're out there trying to find out what is the best thing for the patient, what works and what doesn't work, so that we can keep searching for the answer. If we find after 6 months that the people are stalling out, maybe we give them another round. We don't know. Maybe we do it at 18 months. We don't know. But the point being is the purpose of the medical research studies is to find the answers, to discover what works. Now, one of the things is that whatever the patients need to get to where we're trying to get, we're going to provide it. That's part of our deal. And this allows us to lengthen the dosing, double the dosing, shrink things, do whatever we want. And that is what we're trying to do, is figure out how to treat the disease, not how to get the drug approved. Now, from a selfish point of view, if I can find out what works, then my 3 million for the phase 1 or my 15 million for the phase 2, all the money becomes the risk is dramatically diminished if we found out what works. Now, another advantage of the medical research studies is that we can start new ones very quickly. We have filed applications with the FDA and the heart drug and diabetic foot ulcers. Sometimes it takes a year, 18 months to get even responses or try to get clarification. It is not known for being a quick organization. But as you can see, we were able to proceed with supranuclear palsy and test that patient to see if we can make a difference in the outcome. Multiple systems atrophy is a horrible disease. We were not going to pursue it because the people have a very, very short window. Steve Talbert came to us. He's been talking to us for years. He wanted us to get his wife into a trial. Unfortunately, his wife was suffering with it. Unfortunately, because of COVID-19, we lost years of advancement. All of you know that. And the problem was she passed earlier this year. But Steve didn't give up. He has been on our case. He's coming to us. He came to us and said, please, these people who have MSA have a death sentence. If you don't try, they're all going to die. Give them a chance. So in December, we dosed our first MSA patient. Our December 15th Zhittya update, we have reported on that. We have information on why we think it's going to work. But here's what I do know. At least that patient has a chance now. And personally, I think it's going to work. So as Jack and others have said, in 2023, we do additional medical research studies for multiple sclerosis, autism, strokes, other things. But what I also want to come up with is some of the things that we haven't talked about. Jack is working on a contract with a major university where they're the experts in measuring the blood flow in the brain of Parkinson's patients. We hopefully will take some people there, take images of the blood flow in their brain, come dose them 6 months later, come back and see, did we increase the blood flow in their brain? And if we did, wow, that's a big deal. Now, the reason I make this comment is we have a lot of things going on. And I know that many of you go to our website, you follow us on YouTube, and you're aware of it, but we have a lot going on. Now, I want to take one more moment because we have a lot of people that are on this webinar who run clinics. We have people who run clinics in Malaysia, in Brunei, in Dubai, and in Colombia. They're on this webinar. We are presently have a clinic in the British Virgin Islands that is fully operational. We have clearance in Panama, Mexico, and the Bahamas. However, Jack and I have learned that we need a import license for drugs. And just so you understand, when Jack manufactured the drug in California and we shipped it to Ohio for the heart trial, we did not need an import license. So Jack and I are learning new things all the time. I believe in 2023, all of those clinics will be up, but we're looking for doctors and clinics in other areas. We're seeking clinical partners in Europe, Middle East, Africa, Southeast Asia. All the clinic needs is a chair and clearance from the ethics committee or the agency that allows them to do medical research. Jack has the applications we submitted to the US FDA. Jack has it in English, he has it in Spanish, he has it in French. You'd be amazed at how amazing Jack is able at getting this thing done. But what we've also learned is in those nations which allow medical research in stem cells, we also find a warmer audience. So we'll work with you to help you get clearance if you have a clinic. Dr. Jacobs prepares everything. You get the clearance, and if you don't have a chair, I'll buy it for you. Now, I want to show you, we want a clinic in Southeast Asia. This is a picture of the world. In the circle, you see in that circle, those over half the world's population live within that circle. So the 8 billion people plus on Earth, half of them are within that circle. And Southeast Asia is in the middle of that circle. Now, in addition to, once our medicines are approved in the United States, like the Parkinson's drug, maybe we're approved in 6 years or 7 years. But nations like India, China, Indonesia, Japan, they take additionally 3, 5, 10 years to get approval. India is reported to have 7 million people with Parkinson's. Would some of them travel to Malaysia to be treated rather than stay and suffer with Parkinson's or multiple systems atrophy? I believe if we had a clinic in Malaysia, that somebody in South Korea with Parkinson's would gladly fly to Malaysia to be treated, even in a medical research study, to end their pain and suffering and maybe be able to walk and talk and dance and eat and laugh and speak again. Now, of that 15 million people in that circle, 30 million people overall, half of them are in that circle, that's 15 million people. If only 1% are willing to travel to a clinic, that's 150,000 people. If you work with us and we can set up a clinic in Brunei or Vietnam or Myanmar or in Malaysia, if only 1,000 people a year came to your clinic, you'd have a good business. Now, every day, Zhittya gets about 150 people who register for information on our clinical trials. That sounds like a lot, 150 people a day. That's 55,000 people a year, roughly. Just to put it in perspective, if the people suffering with Parkinson's are 30 million, that works out, the 55,000 work out to be 0.2%. So it's going to take us a long time to get to all 30 million people. So in final conclusion, go to our website, sign up for our monthly newsletter, go to the YouTube channel, subscribe, follow what we're doing. We're going to have additional webinars in 23 about Parkinson's. We're going to have about multiple systems atrophy. Hopefully, we're going to have a webinar, Jack, explaining the blood flows in the brain. And I want you to be able to follow us and see what we're doing. Now, I want to make a comment. We're not telling you we have an answer. We're telling you we think we have a treatment, and that's what we have to discover. In the heart, we've seen data that's unbelievably positive. I don't doubt it. Diabetic foot ulcers, I don't doubt it. We just have to go through the regulatory process in the United States. But we want to thank you for all of your attention. We are committed to stop suffering and extend people's lives. Before we go to the question and answer period, I'd like to say God bless all of you. And sincerely, I hope very much that we'll be able to work with you and show you that we have treatments that are going to change the world. Okay, people have been sending in questions. Let me start with the first one. Jack, this first one is for you. Does FGF1 cause cancer?
We get that question quite a bit. Potent growth factors have the potential, but I can say categorically FGF1 does not cause cancer. We've put huge quantities into animals and never seen formation of a tumor. And importantly, I want to mention when women are pregnant, they have 35 times the amount of FGF1 in their bloodstream for basically 9 months, constant exposure to huge levels of FGF1. And I don't think there's a higher incidence of cancer during pregnancy.
If we give FGF1 to a man, will he get pregnant?
No comment.
Okay. Next question here, Jack. Why the wide range of improvement in the test subjects, 18 to 80%?
Yes, Parkinson's disease is unique to each individual. They all have different symptoms, severity of symptoms. So it's not unusual to see that range of treatment. And again, we're seeing improvement in all the patients we've treated so far.
Here's another question. I guess this one's for me. This is from a person saying, I'm very impressed by what you're doing. How can I invest in your business? The answer is simple. We're planning on taking our business partners public in 2023. We have some great data coming and some very exciting things, I believe, in the first quarter. So the idea is to take it public probably in the second quarter of 2023. Right now, we're working on a pre-IPO placement, and this is not the forum to discuss that. But if you're interested in learning more about investing, email me personally at Dan, D-A-N 333@AOL.com. That's my personal email address, DAN 333@AOL.com. And if you're interested, then I'll have somebody get back to you. Vic, I think this is your question. The person wrote, I have multiple sclerosis. Do you believe FGF1 could treat multiple sclerosis?
We believe that we can treat multiple sclerosis because if you think about it, the majority of the patients are women, about 75% to 80% of the multiple sclerosis cases are women. It's very interesting thing that if women, while they're diagnosed with the multiple sclerosis, if they become pregnant, a lot of them goes to remission. And it is not because of their high level of the estrogen, because the trial for estrogen replacement grossly failed about 15 years ago. So we believe the reason for this recovery during pregnancy is growth factors, because the body of the woman is filled with growth factors while she's building the baby. So we believe that we can recreate this event of the remission, at least in the patients, if not completely cure them, because also there's an interesting fact that nobody knows actually, but there's a category of the MS patients is called singular clinical event. So it means those patients had symptoms, they came to the doctor, they had the MRI scan of their brain, they found the lesion, so they officially diagnosed with MS, and then some kind of event took place in them, and they become completely cured. A singular event means they never will have this reoccurrence of MS at all. So it was only one time. So we actually hoping to create this singular treatment that will take care of them, we hope, forever. And this percentage of the patients, the singular clinical event is about, so depending on the sources, between 30 to 70% of the patients diagnosed. So it is pretty high.
Thank you. All right, next question for you, Jack. Someone is asking, do you think that the woman, Becky Parker's kidneys issues or polyp was caused by your FGF1 treatment?
Definitely not. Definitely not. That we know, basically know FGF1 gets into the body after you squirt it up the nose. There was no exposure to her kidneys, especially her intestinal tract, where if you swallowed FGF1, it'd be destroyed immediately. So I'm very, very sure that that FGF1 did not cause those issues. And as you heard from Becky, her kidney disease, her renal disease cleared up. So maybe the FGF1 was actually helping that.
And how long does it take for a polyp the size of a golf ball to grow into your intestines?
Yeah. I mean, that's 6 to 9 months.
All right, Jack, one more. What is your hoped amount of recovery for Parkinson's disease patients, and how long will it take?
We don't know. I'm hoping 100% improvement recovery, but that's why we're doing these medical research studies. We don't know if we'll have to maybe retreat these patients at some point in the future, but we're going to try. We're going to follow these patients as long as we need to, but we're going for 100% recovery is our goal.
All right, we still have some questions, but Jack, I think we've taken a lot longer than we were planned. It's been an hour and 15 minutes. Ladies and gentlemen, we really appreciate you participating. This video will be put up on YouTube probably in 2 or 3 or 4 more days. If you want to get more information, you can send an email to Sergey@zhityamedicine.com, and you can go to our website, which is zgm.care. If you're interested in the clinical trials registering, or you're interested in medical research studies, you can either go to Cross-Border through zgm.care, or you can go to Cross-Border Medical directly. Once again, we thank you. We appreciate you taking the time to join us on this journey of discovery, and hopefully we will discover a way to make your life better and treat these horrible diseases. Ladies and gentlemen, once again, we thank you. God bless you. Bye.